All right, beautiful people. Good morning, everybody, and hope you are enjoying our weekends. Okay, on today's series of health education on the use of psychoactive substances among our youth, I will talk about briefly other classes of psychoactive substances available. I mean, out there to our youth. Yesterday, I talked about the uh, prevalence of alcohol, cannabis, which I mentioned, Kulos, Loud, AZ, and others. Today, I will talk about other psychoactive substances briefly. I will just mention the common ones available. I mean, the common ones in our street with their street name. There are other psychoactive substances, several of them. All right. The next I will talk about are stimulants, right? And the commonest one among these stimulants is ice. And then the next one is crack or cocaine, crack cocaine, right? Now these substances, they stimulate the central nervous system. They stimulate the chemicals in the central nervous system, right? Okay, as we proceed, I will talk about the neurotransmitters, the chemicals in the central nervous system, how they are affected, and how they cause the psychological illnesses that our youth suffers as a result of the use of these substances. Okay. The next one that we talk about is opioids. So the common ones are pentazocine, tramadol, which is the commonest among them, among our youth, uh, heroin, right? Now, the use of tramadol among our youth is very, very high because there are medications. Let me just state here that there are medications that are not supposed to be dispensed without doctor's prescription. Without doctor's prescription. So, but in our society, it's appalling. It is sad that our youth get access to these substances without doctor's prescriptions. They get access to it. They just go to nearby chemist stores, go to pharmacies and offer money, cash, to these pharmacists or uh, chemist owners, understand, to dispense the medication to them. This not about uh, you know this is not about to induct the pharmacy profession. No, no, far from it. You understand? I'm just talking about these exceptions, the individuals who dispense these medications without doctor's prescription to this youth, and then they use it illicitly, and in the long run suffers, and in the process, I mean, suffers mental illness. You understand? So there are indications for every medication that the doctor prescribe. Doctors don't just take their pen and write prescription for you. There are indications for them. But among our youth nowadays, you see them just a slight pain, they will just go and take tramadol. And that is very common among those who do menial jobs. Then among our youth who engage in this internet fraud, you understand, they take this tramadol um, to get high, and they also think it helps them, it enhances their sexual performance. You understand? So these are the things that we have to look into. You understand? I will go into details as we proceed. Then we have other psychoactive substances like benzodiazepines, amongst which are Suinol, Refnol, which is common among them. You understand? Then we also have other ones such as volatile psychoactive substances. You know, examples include gasoline. Now, our youth go as far as sniffing gasoline, sniffing petrol. You see them with empty can of water. You think, they are just, they put this petrol inside, you understand, and they sniff. Some of them even go as far as sniffing the soak away, the sewage disposal. Some of them go as far as taking nitrous oxide. So these are psychoactive substances that are very common among our youth. It's rampant, it's everywhere. And it calls for concern because I think there are things we have to do differently to curb the excesses of these substances. So I don't want to bore with too much things. I want to cut the video short. Then in the next video, I will talk about how these substances affect the brain, the kind of mental illnesses they cause, and how you can identify them early among your children so that you can present early to the hospital for intervention, right? Thank you very much. Kindly share for others to get to be aware of this, to learn, and also if you have questions, I will be in the comment section to take your questions. Thank you very much.